No. Good afternoon. Good afternoon, friends. 4th February is coming up. In 2015, on 4th of February, the Union International Against Cancer Control, which is one of the largest bodies governing and administering and monitoring cancer based out of Geneva, decided to commemorate this day and call it the World Cancer Day. What they meant to do was to remind the world that cancer is not beyond us. In other words, we can think of ways and means to counter this disease. By the way, I don't know how many of you are actually aware that just based on the kind of knowledge we have about causative agents and what we know about treating and preventing these cancers, as on today, a major portion of the deaths that occur due to cancer can be saved. They can be avoided. And it's not a small amount. Do you know how many people? About 8.2 million people, 82 lakhs around that figure, die of cancer every year globally. That's a huge number. And if our existing knowledge is enough to really prevent all these deaths or prevent a major portion of these deaths, that's really something. That's great. And as far as incidence is concerned, do you know that in our country, according to the latest figures that the Indian Council of Medical Research has given us, in 2020, how many cancer cases landed up for treatment? 13 lakhs 92,172 people. It's a huge number. And if we improve our recording skills and improve our efficiency of recording, and our cancer registries do a good job, you'll actually see that number go up. So that's not a small undertaking at all. And a majority of these deaths are because of 71% of deaths that occur are because of non-communicable diseases, of which cancer is a very important part. About 9% of deaths occur because of that. So in India, 66% of the deaths we have is because of non-communicable and lifestyle diseases. So I think that on this World Cancer Day, as a preamble, don't you think it's a good idea to talk about various things, at least give you some tips as to avoid and prevent cancer? Because that's the best thing that you can do. Small little things that I must talk about. The first thing that I will talk to you about is obesity in your lifestyle, the eating habits. Our eating habits are not great. Do you know that the incidence of obesity across the world is between 20 to 40%, particularly in the adolescent age group? That's where it matters, because whatever happens in adolescence shows its results much later in life. So about 20 to 40% people are obese. They have more body weight than they should have for their age group, for their body stature, for their surface area, for their height, weight, everything rolled into one. And that obesity and increased body weight is very strongly linked to the occurrence of certain cancers. You might want to ask me which cancers, and I'll be happy to answer you there. That breast, uterus, cervix, lung, pancreas, liver, kidney, so many of these cancers, they are linked to obesity. So it's a good idea. It's a very, very good idea to make sure that you don't have. And how does that happen? A small tip for you. How do you make sure that you don't really get that weight? Now, in a week, broadly speaking, if you spend about 100, 175 or 150, more than 150 minutes every week in moderate activity, and if you spend about 75 minutes only per week in doing strenuous activity like running, like swimming, then you will not be obese and nobody will be obese. And therefore, you will not get linked to causation of cancer at all. And if you really want to lose weight, very broadly speaking, you need to put about 60 minutes of moderately strenuous activity most days of the week. If you're able to do that, you're going to be okay. Now, apart from obesity, of course, it's linked to the way we eat, the kind of food that we take, you know, the high carb, fat intakes being much. So your food plate has to be properly balanced. The next thing that I'll talk to you about is something a lot of us in the present day and age in this world like to consume, and that is alcohol. When I talk about alcohol, alcohol is very, very strongly linked to mouth cancer. It's linked to the pharynx, the backside of the mouth. It's linked to the larynx, the voice box. It's linked to the esophageal cancer. It's linked to stomach cancer. It's even linked to breast cancer. So across the board, alcohol has a very strong link with cancer. These are some of the most common cancers that I talked about. Do you know the commonest cancers? The commonest cancers are the mouth cancer, the tongue cancer, the breast cancer, the lung cancer, the cervical cancer. So these have very strong links with lifestyle, and I'm just telling you the story. For instance, alcohol I was talking about, that you're only okay if you take, as a woman, one drink a day. And as a man, you can take up to 2 drinks a day safely. That's what the standard set up by the WHO say. And when I say a drink, I'm talking about ounces. That would make about 1.5 ounces of whiskey for that matter. That make about 12 ounces of beer. It would make about 5 to 10 ounces of wine, not more than that. When I say an ounce is 30 ml. So now you can know if you drink more than that, then you're drinking bad. You're drinking not good for your health. You're drinking your cancers into your life. You need to avoid those and do it. And if you are at risk for any of the cancers that I just talked about, don't drink at all. Avoid. Get in touch with your doctors, tell them your history, and I'm sure most of them are going to tell you, please don't take them at all. That is the story of alcohol. Another very important thing that occurs with skin cancer, for that matter, it's very common in the West, not so common this part of the world, is exposure to ultraviolet light. Ultraviolet A, ultraviolet B, both are important to protect your skin. And when the sun is the strongest, between 10 a.m. and about 5 p.m. in the day, particularly in countries like India, make sure that you protect your skin by wearing long sleeved cloths or apply a sunscreen on most days of the life. It doesn't take much. You can use a sun protection 30 and above, because if you use 30 and below, it will cause it, it will not help you. Lower values will help you get rid of skin trauma and pigmentation. But if you want to save your skin from cancer, which is very common, particularly in the white skinned people who go to beaches and elsewhere, then they need SP protection value 30, ultraviolet A and B, and of course a waterproof sealant on most days a week, and cover your skin. And skin cancer can be prevented. One of the most important things is the pollution that occurs. Do you know that 16% of cancers are because of the air that you breathe in? And the air that you breathe in is in the environment. It has to do with coal tarring and the smoke that is produced by the road works. It has to do with you working in industries like asbestos, watch industries, rubber tire industries, sheet roof sheetings of asbestos. If you're working in that kind of an industry, you are very, very prone to develop a cancer of the lung, a cancer of the lining of the lung, which we call as a mesothelioma, and even a cancer of the ovary. So you want to break a link there. You've got to make sure that you 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 got to make sure that your employers, if you're employing people, you're an employer, then make sure that you provide protection from all these things, because the health of people that work for you is not just the health of those people; it's the health of the nation. The health of the nation, of our country, depends on that. Your economics depends on that. Your future depends on that. You've got to make sure, you've got to incentivize health of people working for you because of the environment. Create a good environment. Tobacco, would you like to talk about it? It's the most often talked. 22% of cancers are linked to the intake of tobacco. Now, so much is talked about tobacco, but you've got to get convinced to not smoke. And very, very simply, there are various measures once you're convinced that you don't want to smoke. First, don't pick up the habit, prevent it. But if you've already got this habit, then get in touch, get some counseling. Because counseling is one of the ways in which you can give up. Set a date. Set a date. And those conditions that make you smoke, whatever the conditions may be, it's conditions of stress in your work environment, stress at home, or any other kind of reactive stress that you get into, avoid them. And of course, create an environment which is friendly to quitting smoking, which means do not hang around with too much with people who smoke and are yet continuing to burn their lungs away. Try and avoid being in that kind of company, or occupy your time with doing other things. And now there are drugs available also. There are patches, there are drugs, there are sprays, there are snuffs, there are all kinds of things. And I would have said nicotine replacement therapies, very common now. So a combination of all these factors, you need to talk to your doctors, get guidance, and get going, because tobacco related cancers, quite a few. They are all over the body. I mean, almost the gastrointestinal tract, the respiratory tract, your mouth, all linked to it. So let's try and cut tobacco out of our lives. The next thing that I will talk to you about is chronic infections. Ladies and gentlemen, friends, wherever you are, chronic viral infections contribute not less than 16% of cancer load. That's not a small amount. And when I talk about chronic infections, I'm talking about two viruses particularly. The hepatitis B virus causes liver cancers, and of course, you've got a vaccine for it. Some head and neck cancers, and head and neck cancers are very common in my country, in your country. And therefore, you need to cut them out, you need to prevent, get in touch, get counsel, medical counsel, get your vaccines against HPV done at the right time. You will save yourself for these two cancers. And of course, if you are practicing in sex, then in that case, do not change your partners very often. A condom will not save you from viral infections, from the human papillomavirus infection. Don't be under that impression. That's a wrong thing to believe. So, very, very small things, 6 tips that I've given you today will, will help you prevent death, will help you not getting agonized and getting into this whole armamentarium of getting diagnosed with a cancer and then getting into treatments. It's expensive. There are many other things you could do. One of the important things when I go away, and I'm only giving this tip to you because I feel about it very badly, that if you have cancer and then you don't have money or you don't have an insurance, you are damned, as damned can be. So why do you want to get that double whammy? You shouldn't. So please get yourself insured. If you're an employer, make sure that your employees are insured and they take their health checkups. Preventive health checks are important. Please be insured. Please have somebody provide you the finances and, of course, the guidance. Give health the priority that it deserves. And if after this pandemic, corona pandemic that we are hopefully getting out of now, you still don't realize it, then God bless you. And if you have any questions, I'm here to take them. Go ahead, shoot, please. And as far as cancers being fatal are concerned, let me add here that whether a cancer is fatal or not depends on various things. It depends on the kind of cancer that you get. Some cancers are more virulent, they've got much more biological aggression in them, very field fire. Other cancers are slow growing and very kind ones. They give you a lot of time to spread. It also depends on what stage that you get treated at. Unfortunately, 66% of cancers in India are diagnosed in locally advanced stages. The results are not so great. But if you're the third and the fourth stages, which are quite a few cancers, like lung cancer, like stomach cancer, like ovarian cancer, like gallbladder cancer, which creep on you, don't create any symptoms earlier on, and you suddenly discover that you've got one of them. And they're not good as far as treatment is concerned also. And if you're unlucky to get one of these, then of course, fatality is something that can look you in the eye. But if you get your cancers in time, you prevent them, you diagnose them early, I can assure you, it's not going to kill you. It'll just be irritating and you get your treatment done with, you'll be over and get followed up, of course. But yes, if you let it creep, ignore it, ignore your symptoms, don't get help and diagnosis at the right time, or if you're unfortunate that you didn't even realize it, then I'm sorry, yes, you're right. Cancers can be fatal, cancers are fatal. I'm happy to take any questions. And just to tell you, my name is Dr. Sameer Kaul. I'm a surgical oncologist at the Apollo Cancer Institute in New Delhi. God bless you. Yeah.
So coffee side.
नहीं बेटा, थैंक यू.